Good morning and welcome to what I hope will be a very informative town hall to answer your questions about COVID vaccine rollout here in Virginia's 10th District. This is a timely discussion with passage of the American Rescue Plan this week and the news from President Biden on vaccines. I'm joined today by Dr. Danny Avula, who's Virginia's vaccination coordinator, and Dr. Goodfriend, director of the Loudoun County Department of Health. The good news is that the American Rescue Plan has been signed into law and help is on the way. This legislation will help us put this pandemic behind us and ensure a strong and equitable recovery. It includes lots of funding for the public health crisis. There's $20 billion for rollout of vaccines and money for rapid testing, contact tracing, and expanding our public health workforce. It includes life-changing relief for families who have been hit the hardest by the COVID crisis. Things like direct $1,400 checks, which should start hitting some people's checking accounts as soon as this weekend. Extended unemployment benefits, historic expansion of the child tax credit, which will help us cut child poverty in America by half. It also includes assistance for lower healthcare premiums and rental and mortgage assistance. Now, as a mom, I want my kids to be back in their classrooms, but I want them to be able to do so safely. So I'm pleased to announce that the American Rescue Plan includes funding for schools in our district of about $333 million to make any safety upgrades that are necessary and hire additional staff or cleaning services to get and keep our kids in the classroom and make up for lost learning. The American Rescue Plan also protects and restores jobs, with additional aid targeted to small businesses hit the hardest by the pandemic, including specific help for restaurants. It includes funding for our towns and counties to prevent cuts to critical services, money for airports and transit, and we've already seen announcements from major airlines and tens of thousands of furloughs are being canceled, and Metro says they will be able to avoid service cuts and layoffs. This is the kind of relief from the pandemic that we've been promising, and I'm proud to have been able to deliver for many families and small businesses who have faced enormous challenges in this past year. With vaccination, improve out and grow, it's the end. I know that Dr. Avula and Dr. Goodfriend have been working incredibly hard to get shots into the arms of all Virginians, and we're also grateful for their tireless efforts. But we can't get complacent now, though. Please continue to mask up and keep following social distancing guidelines. Here in our region, I know that so many of you are eager to get your shot to keep yourselves and your families safe. But for anyone who is hesitant, I just want to say that all 3 vaccines are safe and effective at preventing serious illness or death from this virus. I hope that many of your concerns and questions will be answered here today by our 2 fantastic guests. And with that, I will toss it to them to give a short introduction of themselves and what's going on here in our district and the Commonwealth before we jump right into questions. Dr. Avula, let's start with you. How's it going?
Yeah, thanks, Congresswoman. So great to be here with you all today. Again, my name is Danny Avula. I'm Virginia's vaccination coordinator. And in my former and hopefully future life, I am one of Dr. Goodfriend's colleagues. My day job is the local public health director in Richmond and Henrico. And so as soon as we sort of get underway with Vaccinating Virginia, I'll be transitioning back to that role. But just a quick snapshot on where we're at. You know, things have been moving and really picking up pace over the last few weeks in terms of vaccination. We are over about 19.5% of the state at this point has been vaccinated. That's over 2.5 million doses administered. And so it's been really, I think, both fulfilling for Dr. Goodfriend and I to see this progress, to see us take one big step closer to our goal of herd immunity, our goal to get 75% of our state vaccinated. We are right now, you know, at the beginning of this campaign, we knew we needed to get to about 50,000 doses a day to kind of keep pace and get Virginia vaccinated by the summer. We have surpassed that. Over the last 7 days, we're averaging about 55,000 doses a day. And we've had multiple days where we have exceeded 70,000 doses a day across the state. And so the capacity to vaccinate at large scale is there. And as soon as, you know, we really anticipate the week of March 29th, a new infusion of vaccine with Johnson & Johnson coming in large amounts at the end of the month, that we will really get to our goals much quicker than we previously thought, in large part thanks to the work of Congresswoman Wexton, the federal government really ramping up the procurement and production of vaccine and getting it into Virginia even sooner. Right now, in terms of how we're doing in comparison to other states, Virginia's ranked 4th in the country in terms of our efficiency. So the percent of the doses that we receive, that we dole out and get into arms, and that is just a testament to our local health departments, our health systems, providers and pharmacies who have just been setting up incredible operations all over the state. And then we're 12th in the country in terms of the percentage of our folks who have actually been fully vaccinated, which is appropriate. We're the 12th largest state in the country. So things are going really well, and I see that trend continuing, and we will likely get to some of these goals of getting through the 1B population sometime in the middle of April, and really ensuring that everybody who wants to be vaccinated will at least be able to get their first dose by the end of May.
Lots of good news. Thank you so much, Dr. Avula. Dr. Goodfriend, can you tell us a little bit more about what's going on in Loudoun in Northern Virginia?
Sure. Good morning. And I really appreciate all the work Dr. Avula has been doing this last month or so to really ramp up the delivery of vaccine, to expedite getting those vaccines in people's arms, because that really is critical. And as Dr. Avula mentioned, the focus now has been on those who are at highest risk of having severe complications if they do get infected, are folks who are over age 65, those 16 to 64 with underlying medical conditions, and some of the other key 1B categories. The large majority of our healthcare providers have already been vaccinated if they chose to in the 1A category, same with those of our long-term care facility residents. And really that's critical to keeping people safe. But as we go forward with 1B, we really want to keep all those folks, those essential workers, as safe as possible, because they do have a lot more contact with others in the community. In Loudoun County, our hope is that at this point, we're reaching all those age 65 and over. And if if you signed up, you haven't heard from us yet, you will within the next week. And then those 16 to 64, probably within a week after that. So as Dr. Avula said, we really are on track by the end of this month into early April to take care of all the essential workers who want to get vaccinated. What we are finding, though, is that some folks had thought they had pre-registered, but for whatever reason, it didn't go through. Some folks had registered in one category and realized, oh, I'm also 74 years old. I'm a postal worker and I'm 74. And so we do want folks to get vaccine as their time allows. If they're finding they have not received word from Loudoun County since they believe they signed up, please let us know. Our health@loudoun.gov is our general email address, or 703-737-8300, and I'll repeat that again later for folks. But both of those are critical. We want folks who are at increased risk to get vaccinated. If you have not yet signed up and you are at an increased risk, please do so now. The wait list is not very long. We have great experience with all 3 of these vaccines now. Tens of millions of people have been safely vaccinated with these vaccines. And so we want to get those into people's arms as quickly as possible. The other piece is just really thanking everyone. We're now more than a year since Loudoun County declared a local state of emergency in response to the pandemic. It has been a very long year, and we understand the desire to return to normalcy. But really, this is a critical time with spring break coming up, with family gatherings around Easter and other holidays. How do we keep everybody safe as we get vaccine into people's arms, as we start looking more deeply at other variants of the virus that may be around, so that we can get people back to school, back to work, and safely through the summer? Thank you.
Thank you, Dr. Goodfriend. Well, we have lots and lots of questions that were submitted by constituents. So Justin, I'm going to toss it to you to get our first question.
Absolutely. Thanks so much. So we are going to start out on a few questions about vaccine availability and timeline. So first question here: at the current rate of vaccinations, it would take about a year to get everyone vaccinated. How much do you expect this bill, the American Rescue Plan, to speed up the vaccination rate?
Well, I'll start with this one. I think that the American Rescue Plan will go a long way to speeding up vaccinations. It includes another $20 billion for the vaccine rollout and procurement. The Biden administration has announced that they want every American adult to be eligible by May 1st. So we're going to have to definitely ramp up our distribution of these vaccines. And thankfully, he just announced last week that they were able to procure another 100 million doses of the J&J vaccine, which only requires one dose. So as that rolls out, I think we'll see a big ramp up in vaccinations. Right now, we have excessive capacity and not enough vaccines. So as we increase that availability, things will definitely ramp up. And we had one of the biggest, I think the biggest vaccination day on record for the nation earlier this week I think it was yesterday at over 2.9 million. So we'll be up over 3 hopefully soon. So we're getting there, but we just need to ramp up the distribution and the production. But we're doing everything we can to do that. And we need to also make sure that we're keeping up with the distribution, because we have a lot of mass vaccination centers, but we also need to meet people where they are and find other ways to be able to distribute the vaccine in a way that gets those people who don't have transportation, who don't have easy ways to get the vaccine or come to one of these events. So as we develop those programs, hopefully things will speed up quite a bit. And I see Dr. Avula and Dr. Goodfriend nodding, so I take that as an endorsement of that message.
Yeah, absolutely. And I can maybe make it a little more practical in terms of Virginia. When we think about projecting out our supply and our numbers and our goals, our goal to get to herd immunity is 75% of the adult population. And that the adult population is key, because our vaccines right now are only approved for 18 and over for Moderna and Johnson & Johnson, 16 and over for Pfizer. And so when you take out the pediatric population and then get to about that 75% goal, we're looking at about 5 million Virginians. And so, when we're getting somewhere around 300 or so, well, it's a little bit more than that, 400 when we take first and second doses, over 400,000 doses. At the end of the month, we're going to get an additional at least 100,000 doses of Johnson & Johnson each week. And then more and more vaccine continues to come through different federal pathways to the retail pharmacy program, to the federally qualified health centers. And so our actual amount, the number of doses coming into Virginia by the end of the month, will really get us to a pace where we can easily sustain 70 to 80,000 doses a day around the state, which really does get us to those goals much quicker than we previously thought we could.
And I'm going to take a moment and use Congresswoman's prerogative and ask you guys a question that this reminded me about, Dr. Avula, because I'm the mom of teenagers and I want them to be able to be safe and everything. And I understand that, as you mentioned, I guess the Pfizer vaccine is approved for 16 and up. But are there test protocols in the works right now to determine whether the other vaccines are going to be safe for kids? And if so, what age groups are they looking at?
Definitely. So both Pfizer and Moderna have actively enrolled trials for kids down to age 12. So 12 to 15 for that Pfizer product, 12 to 17 for the Moderna. And I think, that we likely will have data and the ability to go through the FDA process for approval sometime in the fall for that age category. Both Pfizer and Moderna are also just starting to enroll in April down to age 5 for Pfizer, and I think as low as 6 months for Moderna. But those trials won't start for a couple of months, and we likely won't have data on the rest of that pediatric population until kind of late winter, early spring of 2022.
Great. Thank you so much. All right, Justin, I'll let you come up with our next question.
Thanks so much. So our next question here, again, about vaccine timeline. When will Virginia enter phase 1C? And this person asked the doctors to explain a bit about the timeline going forward and an overview of who is eligible in the upcoming phases.
Maybe I'll take it from the state, Dr. Goodfriend, and then pitch to you for Loudon. So right now, the entire state is in phase 1B. 1B is our largest phase and includes individuals who are 65 and over, those who are 16 to 64 with underlying conditions, and there's a whole slew of qualifying conditions that you can find on the CDC website. And then essential work groups in many different categories. Dr. Goodfriend has mentioned some of those, but folks like our policemen and women, our firemen and women, teachers, childcare workers, those who work in the grocery stores and the food and agriculture industry. There's a number, manufacturing, so there's a number of other tiers that all qualify into 1B. 1C is kind of the next grouping of other essential workers, so people who work in the media, people who work in finance, in law, and there's a few others that are not coming to mind immediately. But and then what we decided to do from the state perspective is that every district, every locality has different demographics and are going to move through those categories at different paces. And so what I anticipate really over the next 2 to 3 weeks is that districts throughout the state will start moving into 1C, and 1C is a much smaller category, which is why I actually think in some places that 1C will probably only be about a week. Some places it'll be more like 2 weeks. And when we move from 1B to 1C, it's not a hard stop. It doesn't mean that we no longer vaccinate those in 1B. It's that we look to see when are we seeing slowed uptake. As Dr. Goodfriend's team is rolling out vaccination clinics all over the county, when they start to see that, okay, we're not filling out all of our appointments and we have to go to our wait lists, that's a good indication that we should open up the funnel so that we can maximize the use of every vaccine that comes in as quickly as possible. So there's there'll be a lot of variation about when different parts of the state go from 1B to 1C. We will clearly prioritize the optimization of getting vaccine out the door and simultaneously do the work of working with harder to reach communities to get to some of the more hesitant populations or harder to reach populations.
Yeah, and in Loudoun County, we're really on that same page. Part of the challenge in knowing when that'll happen is twofold. We do have a significant wait list of folks who are in 1B and 1C. But as we're going through our wait list now, we found that a lot of those folks have already been vaccinated. As the pharmacy program has kicked off, some folks have taken advantage of getting vaccinated through that. Some folks had signed up multiple times under different categories, and we've already vaccinated them, and other reasons. But the other piece is we really want folks in these categories to sign up to vaccinate. So as Dr. Avula mentioned, there are a lot of essential workers in 1B and 1C. Because they include everybody, all restaurant workers, all grocery store workers, then we know that they haven't all signed up yet in Loudoun County. Our childcare workers, our teachers have done a really good job of that, as our law enforcement folks have as well. But there are many others out there who would benefit from vaccine early who have not yet signed up. So again, we'd encourage folks, go to vaccinate.virginia.gov. Sign up for a vaccine, because if you are in an essential work group, we want to get to you early before we open it up to the general public. And definitely if you're in a group that is at increased risk for severe outcomes if you're infected, we want to get you vaccinated now. Thank you.
Maybe one more thing I'll add on the phasing and the timeline. The president did announce that he wants all Americans to be able to be eligible for vaccination by May 1st. I actually see that happening sooner in Virginia just because of the pace of vaccination has been happening. So likely, the second or third week of April, we'll start to move into that open vaccination phase.
That's encouraging. Thank you. Justin, you want to come and join us for the next question?
Absolutely. This next question is from Joanne from Centerville, and it's also one we got in the Facebook chat. This individual asks, are grocery store workers and restaurant workers currently eligible as frontline workers for the vaccine in this phase?
And I can speak for Loudoun County. The grocery store workers are in phase 1B, restaurant workers in phase 1C. We have not yet gotten down that list of 1B essential workers in Loudoun County to start offering it to grocery store workers, but we expect to be able to do that probably within the next week as we finish up our 16 to 64 with underlying medical problems of those over 65. And as Dr. Avula had mentioned, for restaurant workers, it's likely going to be the end of this month, beginning of April, before we're able to go into 1C and start vaccinating them.
Great, thank you. Our next question here is from Guy from Ashburn, and Guy asks, many federal agencies are providing letters for federal employees to qualify them for 1C since they are essential workers of the government. Is this something that could be explored for the federal contract workforce? And I think we'll start with the congressman on this one.
Well, I definitely think it should be because, so many of these contractors are embedded in the same facilities with the federal employees. So I think that if you're in one of those national security positions or something like that, you definitely should be counted with those folks as a part of their workforce, especially in the national security area, which we have a lot of those people here in Virginia 10. Where you have to work in a skiff and you can't perform your duties if you're not in that actual physical location. So yeah, that's definitely something we're going to look into and see what we can do to speed up the pace of the vaccinations for those folks and get those operations back to normal as soon as possible. And I saw Dr. Goodfriend nodding. Do you have something that you want to add to that? Because I know that here in Loudon we have a lot of national security types and contractors.
Yeah, and we've seen emails from a number of them who've had those letters. From our standpoint, that proof is not required. When you go to vaccinate.virginia.gov and fill it out with what your profession is, what your risk category is, we'll then pick that up based on what you had said. So if you're an attorney for the federal government, whether you're an employee or a contract worker, put down that you're an attorney, and when we get to that 1C group, in Loudoun County, a lot of them, we have our tech folks that work for the government or work for private industry. So, and IT is a 1C. So please, even if you don't have a letter from the federal government, go to vaccinate.virginia.gov. It has a link where you could see what the 1B and 1C essential groups are. And please pre-register if you haven't done it yet.
Great, thank you so much. This next question comes from Gail from Manassas, and Gail asks, I've heard about reported problems with vaccine appointments going unused. My question is will eligibility be expanded to fill some of those appointments that are unused?
And I can speak for Loudoun County that it would be extremely rare to have appointments go unused through the county process. Our county staff who operate our mass vaccination center at Dulles Town Center have the process down pat by now. So one of the challenges is we don't want to waste any vaccine. So in a 10-dose vial, we have a process where we have a standby list of people who are pre-registered or willing to come at a moment's notice to make sure that every dose is used. I think there's always some folks who do not show up for a vaccine appointment, but if we have an extra vial at the end of the day, we just make more appointments for the next day. So for our process, and Danny is a very good taskmaster on this. That when we get our weekly shipments of vaccine to the Loudoun County Health Department to utilize, it's our commitment to get all of that vaccine into people's arms within 7 days.
And maybe a couple more comments about just how that's playing out in different parts of the state. In the context of an individual clinic, let's say it's a clinic for 1,000 people and we really focused on the 65 and up population. Those are who are going to be prioritized for those appointments. But as we get to the end of the appointment making period, they will then shift down to the next category of eligibility. So they'll shift down to 16 to 64 with underlying conditions to fill the rest of those appointments. Similarly, day of, as Dr. Goodfriend was describing, we have protocols for wait lists, for no-shows, for whatever those extenuating circumstances is, are to bring in folks for the end of the day. And then we really think about this more on a week-to-week kind of timeline. So there were recently some headlines in the Richmond area about clinics that were intended for 65 and up that didn't fill. And in the same way that Dr. Goodfriend just described, those vials were just pushed into the next vaccination opportunity. And so all of those doses were used by the end of the week. And that's the rhythm that we try to ensure for all of our providers.
Yeah. Additionally, as part of our equity initiative in Loudoun County to try to get vaccine to people for whom it either would be a burden for them to try to come to the Dulles Town Center, like our disabled population, or for those folks who are at a disadvantage with our normal electronic pre-registration system, like our non-English speaking folks that don't have access to computers, new immigrants. We do utilize some private vaccinators to go out to those communities to vaccinate those individuals. And as part of that agreement, they do agree that they will not waste one dose. They have to have a plan in place as well for how they will use the last dose in each vial. And if they do have leftovers, we just give them less for the following week to make sure that we don't have vaccine sitting on the shelf.
And I just want to chime in with my personal experience visiting the 2 mass vaccination sites in Virginia 10 that I visited, one at Shenandoah University in Frederick County in Winchester, and one in Sterling in Loudoun County. They both had really, really sophisticated systems for ensuring that no doses went to waste, because especially with the Pfizer and the Moderna, they have to be thawed and brought, up to temperature. So, when you actually do that, you want to make sure that you use what's in that vial as soon as you can. And so they've got a whole system where they determine how many no-shows they generally have and make sure that, they end up with what they need, and that they check in the midday and reassess and prioritize and get people in there. And it was also very impressive to me when I went to the Loudoun vaccination site, because you guys had come into some doses of the J&J that you hadn't been expecting. So you had contacted a bunch of people on the wait list to get them interested, and everybody jumped at the chance. So since you had that capacity, you were able to get it done, even though it was a nice surprise for those folks who were on the wait list.
Yeah, and we're very motivated, as Dr. Avula knows, in Loudoun County, we're very motivated if vaccine becomes available to be able to utilize it. So, for example, today, we have Walgreens that got vaccine through the retail federal pharmacy program, but they didn't have a place to do the vaccination. So, we said, sure, we'll bring you in and we'll give you the bodies to come and get vaccinated today.
Great. Our next couple questions here are about vaccine pre-registration. So first one here is, what do I do if I successfully registered, can confirm on the website I'm registered, but have not gotten an email? Do I need to re-register?
I can tell you from Loudoun's perspective. Fortunately now with the state registration process, you can validate your registration. Again, go to vaccinate.virginia.gov. If you do your first and last name and an email address, it can verify that you are in the system. You are also able to edit your information in the system. But if for whatever reason you think you should have been called and you haven't, or you're not getting any information from either us at the Loudoun County level or from the state system, just email us at health@loudoun.gov or call our call center 703-737-8300. We can look the information up for you. Because again, sometimes someone did a typo in an email address, so it's not going to the right individual. We're also finding sometimes the email is going to people's spam folders. And so checking that spam folder also periodically would be helpful.
Next question here, is there a way to cancel out your registration once you've been fully vaccinated, if you're still receiving messages saying that you're registered and in the queue?
So, through the vaccinate.virginia.gov site, through that pre-registration process, I think last week, towards the end of last week, there was an email blast that went out to everybody asking people to go in and update their information. And the reason for that is that when the pre-registration site was launched about a month ago, it originally grabbed data sources from 70 different places, right? So from multiple health districts, from other people who are keeping lists, and merged that all into the pre-registration site. Now, each of those 70 different data sources were using different fields, different criteria. And so what we've done is we've asked, as Dr. Goodfriend just mentioned, we've asked people to go in to edit their entry and make sure that all that information syncs up. But there's also a way to let them know on that, when you go in and edit, that you've already received your first dose. And then when we pull the lists and we curate those lists for each event, if you have marked that you've already received a vaccine, then you won't be contacted. The other thing that's happening is that on a daily basis, we are deduplicating that list with the Virginia Immunization Information System, which is our VIS database. And so the only problem with that is that it takes a little while, right? If you have an appointment a week out, and once you get vaccinated, there's usually a 2 to 3 day lag from the time that the shot is given, data is entered, and it shows up in our system. And so there may be people who fall in that gap who end up getting a duplicated call, even though they've already been vaccinated.
Great, thank you so much. Next question comes from Debbie from Leesburg. Debbie says, I've registered on Vaccinate Virginia. Once I am eligible to receive a vaccine, how do I find out which locations are administering the Johnson & Johnson inoculation? And this is a question we've gotten from a few other folks as well. Are you able to choose which vaccine you receive?
Yes, definitely, because we know that between Pfizer and Moderna, there's not much of a difference. So we don't give people a choice between those two unless they're age restricted to Pfizer. But there is a big difference between Pfizer, Moderna, and Johnson. One, because one's a 1-shot versus a 2-shot. Some people have preferences based on religious or ethical reasons of one versus another, and some may have a contraindication to one versus the other. So when we do have a Johnson & Johnson vaccine available and are able to offer it, we label that within the VAM system. The VAM system is the system we use for registering for patient vaccinations. We label that clinic either as a Johnson & Johnson clinic or as a Pfizer Moderna clinic, and people can sign up for each. As Dr. Avula had mentioned, at this point, we only have received one Johnson & Johnson shipment, but the hope and expectation is that within the next few weeks, it will be a more regular delivery of vaccine. So when people get the opportunity to choose a clinic, they'll be able to choose one versus the other.
Our next question here comes from Joe from Leesburg, and Joe asks, we are registered in Virginia to receive the vaccine. Is our only option to wait for an appointment, or can we go to CVS or somewhere else to ask to be vaccinated?
So right now, we have a number of pharmacies that are participating through what's called the Federal Retail Pharmacy Program. And so in addition to what comes to the state and then gets doled out to the districts, there's a separate channel that goes directly to a group of pharmacies. Now, most of those pharmacies have been linked with us and have partnered with us, and they're using people who have pre-registered on our list. Each of the local health departments are helping get those lists to those different pharmacy partners, and they're registering off of that. Some of the pharmacies for technological and otherwise, CVS as one example that's part of a big national network, wasn't able to seamlessly do that. And so since they've been on board this past month, they have had a separate registration pathway on the CVS.com website. And I think, now that we're moving into an environment where really supply is becoming less and less of our concern, I see more of that happening moving forward, where our pharmacy partners who have been working on our lists can start to open up and really serve 1B broadly, and then eventually 1C in the general population. We'll be making some decisions and figuring out the logistics of that this week. But what we will commit to the people of Virginia is that we will post on our vaccinate.virginia.gov website what pathways there are to get vaccinated outside of the state pre-registration system, because ultimately that's what people want to know. I mean, do I pre-register, or are there other pathways that I can pursue? And so we'll make sure that's really clear when some of that gets worked out this week.
Yeah, and then tagging on to what Dr. Avula said, I think the ultimate goal is, once there's sufficient vaccine and we're vaccinating the general public, that people can get vaccine just like they get other vaccines. Through their neighborhood pharmacy, through their local doctor's office, when it's not as essential that every dose is used as quickly as possible, but we want to get it as to people so that they have the minimum barriers to getting vaccinated.
So that leads me to a question about the CVS pharmacy, because if they're not interoperable and don't talk with the Virginia system, then are they going? Do we know which kind of vaccines they're getting? Are they getting the J&J, or are they getting the Pfizer Moderna? Because if you do get vaccinated with that first dose at the pharmacy, how are we going to? Are the people who do that going to be responsible for making sure they come back in 20, 21, or 28 days, or is there going to be a system set up to ensure that they get notified and they come in and get it done?
So to clarify on the interoperability piece, they're not integrating into our system on the front end. They're not pulling people off of our lists, but everybody who gets vaccinated there is feeding on the back end into the state database. So all that information is being captured. We have those records in the Virginia Immunization Information System. And right now they're getting a mix. They are getting a mix of Moderna, Pfizer, and Johnson & Johnson. And then based on their ability and preference, as that's being doled out by the federal government, not every pharmacy has all three options. I think that will be the case in likely May, where pharmacies have multiple options. What I've seen so far is that they're really choosing to receive one or the other just to keep inventory management simple. But the question around first and second dosing, every provider who provides a first dose of Moderna and Pfizer is expected to make an appointment and follow up with that second dose. So the goal is to get your second dose at the same place you got your first doses. That's how the doses are doled out by the federal government. And so if you received a vaccine at one of those other pharmacy providers, you'll go back and get your second dose there.
Great, thank you so much.
Yeah, and just for folks in Loudoun County, that system has been working for the large majority of Loudoun residents. We do have some folks for whom, for whatever reason, it is not working. They got their first dose and then moved to Loudoun County, and so now really it doesn't make sense for them to go all the way back to Oregon to get a second dose, or for whatever reason that provider's not vaccinating anymore. So just let us know if you fall in that crack, and we can preferably work to see if we can get you your second dose where you got your first. But if not, we don't want anyone to miss their 42-day window for getting vaccinated again by virtue of them not being able to go back to where they got their first vaccine.
And maybe one additional point based on what David just said about the 42-day window. Right now, the recommendation is that for Pfizer, it's a three-week dosing interval, and for Moderna, it's a 4-week dosing interval. But the CDC has said that 42 days really is acceptable as a window for that second dose. So there is a grace period for those who may be getting anxious at that 3 or 4 week mark.
We actually got a related question in the Facebook chat from Sarah from Manassas Park. And Sarah asks, it seems there are no CVS pharmacies near us administering the shots. Will they add more at a CVS near us? And kind of follow up on that, where can someone check to see which pharmacies may be administering or part of that federal program?
So yes, they will be adding more. The federal allocation to retail pharmacies has been increasing each week, just like the state allocation has been increasing by small amounts each week. Again, when we get to that week of March 29th, we're starting to see the Moderna and Pfizer allocations across the board start to level off. But we, we received about 69,000 doses of J&J last week that went to the districts to perform these mass clinics. We'll be getting much less, under 10,000 doses a week for this coming week and the following week, the week of the 15th and 22nd. But then expect over 100,000 new doses the week of the 29th. And so absolutely the retail pharmacy footprint will expand. And the best way to check on that, CVS.com will show you all the stores and all the appointments that are available. Increasingly, Walgreens in some areas are working off of our lists and working sort of in closed pod scenarios, but there are a couple of examples around the state where Walgreens is opening up more widely to 1B. So if you just go to the websites for some of those providers, but as I said, when we make the decision on how the pharmacies across the board are going to manage their allocation, likely this coming week, we'll make sure that's on the vaccinate.virginia.gov website so that people have clear information about if they're not going to be slotted through pre-registration system, where else can they go to sign up for appointments.
Great, thanks so much. Our next question also comes from Facebook. And this question is, what are you doing to get vaccine clinics in Prince William County?
Well, we monitor the data in terms of the rate of doses, rate of individuals administered in every county. We do make some week-to-week decisions to try to provide more vaccine to communities that have lower rates of vaccination. We have a little bit of influence over that federal retail pharmacy program with the pharmacies who are interested in doing more, kind of closed pods, meaning that they're going to work alongside our health departments and work on specific populations. So last week, Walmart was able to set up clinics in Prince William County to help augment some of their vaccination efforts. We also are actively pursuing these CVCs, these community vaccination centers for Prince William County. So the CVCs, just to say a couple of quick words about those, these are federally funded through FEMA dollars, but state managed vaccination sites. And this coming week, we'll be opening the first 3 of these sites, one in Danville, one in Portsmouth, and one in Petersburg. And then next week, we're looking at the feasibility of starting one of those in Prince William as well.
And Dr. Avula, I again want to put in a plug first for something in Manassas Park, because they have been hit very hard. And the CVS in Prince William that is administering the vaccine is all the way in Gainesville, which is not at all convenient for that area. So I'm just again going to put in a plug. And I know that our viewer was also from Prince William, from that part of Prince William, from Manassas Park. So please, please, please bring us one of those pop-up events if you can.
Okay, will do.
So our next couple questions are about health considerations with the vaccine and mass vaccinations. So the first one here is, could you expand on the new guidance the CDC released on precautions to take once individuals are fully vaccinated?
Yeah, I can. So there was new CDC guidance that came out this past week that really helped clarify, once you've been fully vaccinated, what does that allow you to do? What kind of behaviors can you engage in with masks, without masks? And the quick summary there is that once you've been fully vaccinated, which we consider 2 weeks after your last dose, so your second dose from Moderna Pfizer, or 2 weeks after your Johnson & Johnson vaccine, you're considered fully vaccinated. And in those scenarios, you can gather with small groups of other individuals who have been fully vaccinated without wearing masks. So for families and friend groups, this is a really exciting evolution. And then the next 2 pieces of guidance are you can also congregate with a small group of one other household of individuals of those who have not been vaccinated without masks. So if you have been fully vaccinated and you're a grandparent, let's say, you can go hang out with your grandkids, even if they haven't been vaccinated, in that small group without masks. Where it gets hairy is that you start to add multiple households, because the multiple households increases the mix and potential of introducing new variants to the mix. And so the guidance is still, if you are going to group with multiple households, then you should still mask and distance. And maybe just a quick word on the variant concern. We have really seen the emergence of the UK variant here in the United States. It now accounts for about 20% of the circulating COVID viruses here in the States. We anticipate that by the end of March, maybe the beginning of April, it'll be the dominant strain here in the U.S. And that has been the course for many other countries. I was talking to colleagues in Israel a few weeks ago, and from the time they saw their first UK variant, 2 months later, it was between 70 and 80% of all of their new cases. And so it is, rapidly moving. It is more contagious than the previous versions of COVID that we've been seeing. But the good news is the vaccine is still very effective against it. So part of our desire to get vaccine out with such speed and efficiency is that the faster that we're vaccinated, the quicker we're going to be able to stem the spread of these disease. And as we see these other new variants, the B.1.351, which is the South African variant, and then the P1 variant out of Argentina, we're continuing to collect data on those. We don't know yet what the vaccine efficacy against those look like. And so as we learn more about those variants, as we learn more about the vaccine's effectiveness against those variants, we'll certainly work those into our guidelines. Right now, as an example, Moderna is in development for a booster that includes those other variants. So, we'll see how this pans out. And obviously our hope is that we get enough of Virginia vaccinated quickly enough that we start to just see a decreased spread overall of COVID. But I do think that these will be part of our story as we move forward in the years to come.
It's very helpful. Thank you, Dr. Avula. Our next question here is a bit of a follow-up on that from John from Sterling. And John asked, what kind of educational outreach efforts will local, state, and federal governments undertake to help the public understand how vaccines affect virus transmission and the importance of public health safeguards to be maintained, at least for the relatively near term, even after vaccination?
I can speak to what we're looking to do in Loudoun and in Northern Virginia. In the fall, we did a regional campaign to educate folks on how to stay safe with COVID and the importance of testing and where folks could get tested, because we knew that certain subpopulations were less likely to get the information and less likely to get tested, particularly our Spanish-speaking populations. And so we're entering into a similar agreement using COVID grant funding to do a regional effort, hopefully starting in the next month or so, to educate folks on the safety of vaccine, the importance of vaccine, and really the critical aspects of mitigation, even with vaccination. Because as Dr. Avula mentioned, it's going to be a long time before we hit herd immunity. We don't know how these variants are going to impact the course of disease over the summer. And we really need to reinforce the critical role of mitigation. And I think it may have been Governor Northam or it may have been Dr. Avula this past week who used the analogy of Swiss cheese, that and if it was you, Dr. Avula, you may be better able to explain it. But talking about how using all these steps are critical, because each one by itself is like a slice of Swiss cheese. It has holes in it. But if you add each of the mitigation steps and vaccination on top of each other, you cover up those holes and protect people the best way.
I think you nailed it.
Great, thank you. Next question here, similarly about health concerns. Is it still possible to transmit the virus and be asymptomatic once I am fully vaccinated?
There you go. So the data is still not super clear about this. And this is why the recommendation up until this past week was once you've been vaccinated, continue to wear masks and continue to socially distance. Because what we were just not sure of is, can you still be a carrier or a transmitter of the disease once you've been fully vaccinated? So on data gathering is still ongoing there. I expect that just like we saw this last week, a step forward in the guidance that is more permissible about the kind of activities you can engage in. I expect that will continue, to open up as we have more and more certainty that we're not really seeing much disease transmission out of fully vaccinated individuals.
Great. Next question here. What are the contraindications with each vaccine for those who have a history of histamine responses? Is one vaccine showing less of a risk for histamine response?
So currently, the only contraindications around these vaccines are a known allergy to one of the ingredients of the vaccine, and you can go to any of the vaccine websites to look at what those specific ingredients are. The data during the trials and even subsequent to that have showed that the Johnson & Johnson vaccine appears to have a lower number of allergic type responses than the Moderna and Pfizer vaccines, but all of them have extremely low rates of allergic type responses. So, I think if you have specific questions about reactions that you've had to vaccines in the past, or concern about one of the ingredients of the vaccines, it would be best to talk that over with your healthcare provider and then decide what pathway you want to go.
And Dr. Avula, have you all seen instances of these allergic reactions taking place, like in a time at a later time than just that initial after the injection time? Because I know that when people are vaccinated, they have to sit in a waiting area and a holding area for 15 or 20 minutes and make sure that they don't have any reaction. But have you heard instances where something happens after that period of time?
Well, so the most concerning reaction, that anaphylactic, big allergic response, really is generally a short-term response, which is why there is that 15-minute observation period. Now, there are other manifestations of allergic reactions like hives or itching, nausea, that people may have after that 15-minute response, and we certainly have seen that. When people have those, there are kind of two pathways. One, everybody who gets vaccinated can enter their experience and any concerning symptoms through an app called a vSafe. Or if they talk to a healthcare provider, the healthcare provider will log that information into a national surveillance system. The state portal is called VAERS. It is the national one. It's Vaccine Adverse Event Registration System. So the VAERS national surveillance system is gathering all this information from health providers and individuals, and then like from a national perspective, trying to figure out, are there increased instances of allergic reactions in certain subpopulations? And so that's what the ongoing monitoring and surveillance looks like. But to date, we haven't seen any changes in the guidance based on the collection of that data.
Very good. Thank you.
Next question comes from Joe from Gainesville, and Joe asks, because of certain medical conditions and other medications that he's taking, it's important that he gets the vaccine at a specific time. How can I go about arranging that, and who should I contact? I don't wish for special treatment, but balancing these two procedures is necessary to make sure they don't do more harm than good.
And I can speak to how it works in Loudoun County, because since there are currently two major systems for enrolling people for vaccination through health departments. The VAM system, which is the one that we're still using, was the original system, and another system called PrepMod. And so I could speak better to the VAM system. But if someone is pre-registered with us, it's their turn to get a vaccine offered to them. They'll get an email from the CDC, which tells them how to sign into VAMs. When they do that, they will see a list of clinics that are already available in their area. But typically in Loudoun County, we're only populating it a week in advance. So we have heard from folks, whether it's because they're on blood thinners or some other medications, that their doctor recommends they stop it more than a week in advance prior to getting vaccinated. That once they're in the system, that they can feel confident that we're going to continue to offer clinics every week. So if they need more than the time interval then that's allowed based on what they see for that clinic, that's fine. Just wait another week, go back into VAMS, and then you'll see a clinic that you can sign up for that gives you enough of an interval between when you stop your medication and get vaccinated. The other piece, just for folks in general, because we don't want them to lose a place in line, is that 14-day period between when you receive a COVID vaccine and you receive any other vaccine. So around this time of the year, there are not many flu shots being given out, but if you're getting your single shot, if you're getting your tetanus booster, if you just know that if you're soon to come up potentially for your COVID shot, just put those off for a bit so that you don't lose your place in line based on that interval time between other vaccinations.
So Dr. Goodfriend, I guess what you're saying is that if they need to stop taking a medication and they get offered a clinic, then they can decline that clinic and they'll continue to come up in the queue for the next round of clinics in the following week?
Yeah, in the VAM system, it's a passive look to see what clinics are available. So you're not offered a specific clinic. You're just shown all the clinics that are available to you. And in Loudoun County, as I said, we open those up a week at a time. So when you register in VAMS, you'll see what's available. If, say, your doctor says you need 10 days or 14 days off of your medication to get vaccinated, and the last clinic that you see is 7 days away, in general, you could feel safe that you can stop your medication. You check again in a week, there'll be one at 14 days that you can sign up for.
And they're not going to lose their place in line?
No.
Okay.
Now, once you're extended an invitation for, and again, it may be different, Dr. Avula could speak to PrepMod better than I can, but for VAMS, once we're able to offer you an ability to get into VAMS, you don't lose that ability to be in VAMS. So you can sign up for your first dose whenever you choose to, and whichever product you want if we have it in stock. But then also you'd sign up in VAMS for your second dose.
Great. Thank you so much.
And that's true for other platforms as well. I mean, if you pass up on your appointment, you won't lose your place in line. You'll just circulate to the next available appointment. And that maybe the specifics of the question that I think Justin posed were around the time of day, and so increasingly what we're going to see over the next few weeks is that more and more pharmacies and more private providers will be receiving vaccine and able to serve their distinct patient populations through that. So it will become easier to have kind of that specific time slot. But right now, through CVS as one example, you can sign up for a particular time slot if it's available. But all of this will get easier towards the end of March.
Perfect. Very helpful. Thank you. Our next question here comes from Jack, and Jack says, I'm a senior with a compromised immune system. I've had both Moderna shots. Is there any value in being vaccinated with a different vaccine, Johnson & Johnson, or some other which becomes available after the bulk of our citizens have received their vaccinations?
Jack, I've seen the question come up a few different places, and because of the way that the vaccines work, I mean, both of them, the Johnson & Johnson, Moderna, and the Moderna and Pfizer are kind of built on the same platform. They are all addressing the same portion of the coronavirus, that spike protein that sits on the outside of the virus. So being vaccinated with multiple vaccines, conceptually wouldn't confer any additional benefit, and I'm not aware of any studies that are currently pursuing this. I do think the one thing that will add to getting an additional vaccine down the road will be if the variants continue to be a bigger and bigger part of the milieu, and will we need that booster to capture some of the variants that aren't potentially as well defended against by what we've got now. So stay tuned for that.
Great. I think we got time for one more question. This one comes from Anne from Leesburg. And Anne asks, for people with underlying health conditions such as cancer, what is the average wait time for a vaccine appointment after completing the pre-registration program?
So in Loudoun now, if you were to sign up today as a 16 to 64 with an underlying medical condition, we'd probably be able to vaccinate you within 2 weeks. We know that it's been frustrating for folks who signed up in January 15th, and we're just getting to them now. But at this point, I would encourage anybody, if you've got an underlying medical condition that puts you at increased risk of severe outcomes from COVID and have not signed up yet, please do it. We really want to get to you before we get to the general population.
And I think that's time for us, because I know that you guys have a lot more to do today. This was really fantastic, extremely informative. I hope for everybody at home that we managed to answer your questions from these great experts. Dr. Avula, Dr. Goodfriend, thank you so much for joining us today. And thank you to everybody at home. Do you guys have any closing thoughts for us, starting with you, Dr. Avula?
Yeah, thanks, Congresswoman. I guess I would just say that we are on the cusp of really kind of moving past this, right? I look at what's going to happen through the months of April and May. We will make massive strides towards herd immunity and towards being able to get some of that, that normalcy back. And so I just want to encourage everyone who may be on the fence to think about the value of you getting vaccinated, certainly for your own personal health, but also for our communal health. It's a really exciting time of our life, given the last year that we've all lived through.
Yeah, and I'd like to echo that, but also to tell folks we're not out of the woods at all with coronavirus. While in Loudoun County, we're averaging now about 60 cases a day, much lower than the peak of about 300 cases a day during the second wave that we experienced around New Year's. We're still at around where we were in October, November, when we were saying this is way too many cases. And as Dr. Avula mentioned, these new variants are just looking for opportunities to spread when the mitigation steps are not being followed. So it really is critical as we're getting to barbecue weather, spring break, key holidays. How do we get those numbers as low as possible, both through mitigation efforts and through vaccination, to really minimize the chance that new variants that are not going to be covered by this vaccine without a booster don't take hold, and to keep folks safe. We have about 264 Loudoun residents, unfortunately, that have passed as a result of coronavirus. And this is the time where we really got to put that effort in to keep that number as low as possible.
Dr. Avula, Dr. Goodfriend, thank you so much for joining us today. I share your optimism, but also your cautious optimism, because that plateau of the number of cases is very concerning. I mean, it's not still dropping. So this is a persistent virus. As we need to continue to practice social distancing, mask up, and please get vaccinated as soon as you are eligible. Thank you so much for joining us today. Take care and stay safe, everybody.
Thank you.